Hi, my name is Marjorie,
And I'm Suman.
and for our research project, we chose the topic how poverty reinforces drug addiction.
Okay, so to start off, with a disclaimer, this information on this presentation has been gathered by reliable sources, so there will be a works cited page toward the end of this presentation.
So, how does poverty reinforce drug addiction? It reinforces drug addiction through harmful environmental exposure, mental health illnesses, limited opportunity and access, and systematic barriers that cause hardships to recovery. And we will be going in depth on each of these topics in the upcoming slides.
So let's start with harmful environmental exposure. So harmful environmental exposure is often found in poor neighborhoods, often have more population, like lead and chemicals, and this can harm brain growth and make addiction more likely. There's also bad housing, which adds to stress, which is known for a risk factor for using drug use. And noise in crowded homes can cause anxiety and sadness, also being a factor for the use of drugs and the likeliness to use drugs. There's also factors like not having clean air and water in poor areas, which leads to health problems, and some people turn to drugs to deal with them. Poor areas are often more people of color, face more population, a problem known as environmental racism.
Now we come to part two of harmful environmental exposure. So there are higher crime rates in poor areas, which cause trauma and stress, and many people turn to drugs because of these. There are few safe parks or places to relax, means there are fewer healthy ways to cope with these feelings. So many people turn to drugs, and it makes them way more susceptible to them. We just mentioned environmental racism. So environmental racism puts poor and minority areas at higher risk for stress and mental health problems, which can lead to addiction and many more problems. Seeing violence and not feeling safe causes trauma like PTSD, which is also linked to drug use. And the lack of money spent on such poor neighborhoods means bad living conditions will continue. And a solution is improving these places can greatly help reduce addiction from these environments.
So next we have mental health illnesses. So stress from being poor can lead to things like depression, anxiety, which are often connected to drug use. Poor people are often to go through more trauma, which obviously leads to more drug use to make themselves just feel better. Daily stress from things such as money problems, housing issues, or not having enough food can lead to using drugs to cope with these issues. And poor areas usually do not have enough mental health doctors or clinics, so people don't get the help that they need, even if they wanted it, just because of how far and how it's not around them to get this help they need. And many people are even scared or ashamed to ask for mental help, which keeps them away from just getting better overall. Helping poor people with mental health is a big part of stopping addiction.
So now we come to part two of mental health illnesses. People often use drugs to try to feel better when they have a mental health problem, but it does nothing and it does not support them. Drugs can make mental health issues even worse, which creates a cycle that's hard to stop and which just makes it more susceptible. People with mental health illnesses or addiction are often judged, which keeps them from asking for help because they're afraid of what other people will think. Mental health care that respects different cultures is so hard to find, especially for minority groups. And combining mental health and addiction treatment often works better than treating just one issue. And such local programs that understand the needs of such poor communities can honestly make such an impact and lower drug use.
So next we'll be talking about limited opportunities and access. So poor schools usually don't give kids the same chance to succeed, which can lead to hopelessness and drug use. Things such as few job openings in poor areas cause financial stress. It can even push people toward drug use. The lack of nearby hospitals and clinics where people can't get the help for drug or mental health problems, which we discussed in the previous slides. And things such as bus or train services in poor areas that are not available make it hard to get access to treatment centers. And without internet, people also can't even look for jobs, schools, or these support programs overall. So fixing these problems will help people in poor areas get the help that they need or that they want.
And now part two of limited opportunity and access. So not enough affordable healthcare services mean poor people can't afford addiction or mental health care services. Without good public transportation, like we just mentioned, it's honestly hard to get to treatment centers on time or even get there. No internet and technology access keeps people from finding help. And many people don't have the money to pay for these treatments, as so many of them are also in poverty and are going through so many things, and they just turn to drugs, and it just makes their addiction so much worse. Long time waits in such programs can honestly make people give up and fall back into their addiction and get them more addicted. And putting money into healthcare and outreach programs is so crucial to such areas.
So next, we'll be talking about systematic barriers to recovery. So drug use is often punished by jail instead of being treated like a health issue. People with record of drug crimes have a hard time finding jobs, homes, or just going to school, and they actually are being judged or treated badly for having addiction to stop people from getting help. And not enough programs, especially good ones, are available in poor areas, so people go without these treatments. Now, some health insurance plans don't even actually cover drug or mental health care, which is a big thing that is needed when trying to recover from these issues and not get addicted to the use of drug. To solve this issue, we need to change the law to treat addiction as a health problem and not a crime. Otherwise, people will not get the help they need and will not change overall.
Now we move to part 2 of systematic barriers to recovery. Poor areas often don't have clinics or recovery programs. Negative views on addiction stop people from getting help, and many poor people don't have health insurance that pays for these treatments as they don't have the money to afford it, and it's so expensive. Unfair system, unfair systems and racism make it harder for people of color to get care. To help people get better, we need to fix these big system problems with new laws and more funding and political intervention. Local groups and people who've gone through addiction can offer strong support and make recovery easier by sharing their experiences.
Lastly, this is our works cited, so any information that we have in the slide will be coming from these sources that we have linked here.
Thank you so much.
Thank you so much.